Total hip replacement is one of the most common surgeries performed today. In tonight's SSM Health Medical Minute, Dan Gray reports on a less invasive approach to hip replacement surgery.
SSM Health DePaul Hospital orthopedic surgeon Dr. Gregory Nelson specializes in the anterior approach in hip replacement surgery.
Big research studies have shown that anterior approach to the hip has reduced the rate of dislocation or hip instability by about 50%.
The anterior approach goes through the front of the hip as opposed to the more traditional posterior approach, which goes through the back of the hip. Dr. Nelson says a smaller incision is used in the anterior technique instead of cutting through muscles and tendons in the posterior technique.
There's been several studies that have shown that the anterior approach does give patients a faster recovery. There's some data that shows that there's a more normal stride in their gait at 6 weeks compared to 3 months or 6 months with a posterior approach. The big key for me as an orthopedic surgeon is I need to be motivated to always look for how can I make myself better so that I can provide for patients better care. In this particular area, I felt like the anterior approach really does that.
For the SSM Health Medical Minute, I'm Dan Gray.